The Hospital Corporation of America received a 10-day notice of the intent to strike by more than 2,400 registered nurses. So let's talk about their plan and their motivation. For that, I want to bring in rapid response nurse Erin McIntosh and Catherine Montanino, a staff registered nurse. So both Erin and Catherine, they currently work at Riverside Community Hospital in California. Erin, can you just start by describing the current conditions at your hospital right now that are frustrating for you?
I'd like to start off by first saying that the issues that we're facing now, they began long before the pandemic, and they had been going on for a very long time. Our estimates of April of last year were that we were 340 nurses short at that point. It was further exacerbated by the fact that during COVID, when it first hit, instead of amplifying the amount of support that we had, HCA, our parent corporation, canceled contracts and further worsened our shortage. So first, let me start off by saying that it began before the pandemic, but now it's complete chaos. It feels very unsafe, and we feel very unsupported. And we understand that a lot of nurses across the nation are going through many, many struggles. But ours began long before the pandemic.
And so, Catherine, to that point, what was the breaking point for you that made you say, okay, we have to do something radical here? What was your breaking point?
I think the breaking point is when, to support my coworkers, to make sure that my community is taken care of, I'm working over 20-hour shifts and not even one bathroom break or a drink break, despite record profits for our parent corporation. Seeing that we've had the highest infected nurses compared to the surrounding hospitals, and the harassment, intimidation just to get protection and PPE and assistance to not take it home to our loved ones or give it to other patients that are vulnerable. Despite cries, despite attempts to work in partnership, we were shut down and we were left with this as our only option.
And Catherine, can I ask you how that feels, knowing that that's what you're walking into every day when you go to work? How does that affect you?
Well, I've worked there now just coming on 13 years, and I have many coworkers that have been there longer than myself. And it's gotten to the point that we can't even sleep the night before our shift, because we're with such moral and ethical distress and the panic of knowing of the chaos that we're walking into without any support. We understand the situation of COVID and the pandemic throughout the United States and the world for that matter. But to feel unsupported as we have record-breaking profits and on top of that, decreasing support staff and resources, they're endangering not only our own lives, but ultimately the lives of our patients and our community. And that's why we're doing this.
Wow. And Erin, I want to ask you, Catherine talked about what it's like when you all try and go ask for assistance. What was the reaction when you gave the notice of the strike? Were there offers for a negotiation or anything?
So, they're very angry with us for giving the strike notice. And I want to tell you that it was with a lot of struggles that we came to this point. We've been negotiating since after our strike in June. We've been negotiating since July. So for months, we've been trying to come together with an agreement. And when we told them we were going to give a strike, if they didn't come to the table, they told us, oh, well, we're not going to come back and negotiate with you anymore. Fortunately, they have continued to come back, and we've been at the table every single day for the past 7 days, up until 1 a.m. It's overwhelming.
Yeah. So Catherine, I want to ask you, do you feel like this strike, because we're going to a place you've never been to before, at least the two of you personally, do you feel like it has been a wake-up call to hospitals, your hospital, or maybe even Americans who are now seeing our health system in a different way?
I do think that it has been a huge wake-up call, not only for us in the United States, but for the whole world. Some hospitals, even in our area, have risen to the challenge despite everyone facing hardships and trying to do the best that we can. But unfortunately, where we work, that has not been the case. We've been fought at every step. We've asked for help. We've asked to do this together. There are other facilities that their administrators put on scrubs, and despite them not being healthcare professionals, they are there and doing manual labor and helping us feel supported. We don't do this for praise or accolations. We do it because we care. We don't want to step away from the bedside. We want to be in the hospital, taking care of our patients and taking care of each other. But we need help. And only our hospital, those administrators, and our parent corporation are the only ones that can invest in us so that we can invest in our community and into our patients and keep them safe.
All right. Well, Catherine and Aaron, thank you so much for the work that you do. I can't imagine knowing what you're walking into every day and still being able to do your job and work those long hours. So thank you for doing that. And please let us know how everything goes. We hope that things are able to get better for you both and nurses all around the country.
Thank you for having us.
And thank you for hearing our voice. We appreciate you very much.
Absolutely.